Hey y'all, welcome back to the reading room. So just wanted to chat about this patient. This is a male castrated 10-year-old mixed breed dog who presented with dysuria and on physical examination was noted to have some back pain. So lumbar radiographs were required. So these are nice radiographs collimated to the spine. This is a really important feature of radiography of our vertebrae. We need to be taking collimated radiographs to really improve our radiographic quality. And so that's what we did in this instance. Took these nice collimated spinal radiographs. Patient was really heavily sedated for these to try to get as straight as possible. And what we can notice in this instance is that there is some lysis present at the level of L6 and L7. So this patient has an aggressive osseous lesion of L6 and L7, predominantly characterized by lysis, with some additional osseous proliferation along these margins. So what we should be seeing is a nice ventral cortical margin of the vertebra, and in this region here, and in this region here, that has become lost. So this is evidence of vertebral body lysis in this patient. Now how can we relate this back to the patient's presenting complaint of dysuria? Well, patients with lower urinary tract tumors, whether it be urothelial cell carcinoma or prostatic carcinoma, can actually present with metastasis to the lumbar spine or to the medial iliac or the lumbosacral lymph center, so medial iliac lymph nodes. And so in this instance, we might have a little bit of an increased soft tissue opacity here, which we don't have optimized for view because these are lumbar radiographs. But we could take abdominal radiographs in addition to this to further evaluate that, and we could look for evidence of mineralization in either the bladder or prostate, which might be evidence of neoplasia in those regions. The next step would need to be ultrasound to further characterize the change in the lower urinary tract, and of course then staging thoracic radiographs should be performed, which we did in this instance, and did identify that this patient had a pulmonary metastasis. So once again, we've got radiographs of our lumbar spine highlighting some vertebral body lysis, and these are some important features to look for: loss of that ventral margin, lucency, and irregular osseous proliferation that doesn't look like the typical spondylosis deformans. So I hope this has been helpful, especially the next time you have to evaluate a patient with back pain or potentially a patient with metastatic lower urinary tract